Today at On Salus Health, we explain cortisol and its function, as well as the causes, symptoms and treatment of high cortisol levels in the body. Having high cortisol is medically known as hypercortisolism, something related to Cushing's syndrome. Although it's not a very common disease, its appearance may be due to excessive consumption of corticosteroid medications. Those who suffer from this disease tend to be overweight, since high levels of this hormone favours fat accumulation and storage. Cortisol is a hormone that is produced in the adrenal glands and is responsible for the storage and use of energy in the body. It also influences other processes such as blood pressure levels and stress response. What is cortisol used for? Cortisol is necessary for the functioning of our organism. Problems occur due to the quantities in which this hormone is produced. When you're under stress, the hypothalamus sends alert signals to the nerves and glands. These are automatically activated and send large amounts of energy to the muscles. Cortisol in the appropriate amount serves to regulate blood pressure, control the effect of insulin to maintain normal blood sugar levels, regulate the immune system, control and respond to stress, use sugar and fat as a source of energy for the body, and also store it for times of prolonged fasting. Causes of high cortisol levels. Excess cortisol in the blood can be a consequence of many causes. The reasons of high cortisol are usually stress. Cortisol is known as the stress hormone and is produced in our body as a defense mechanism to help it react in times of physical or emotional tension. When this happens, the functions of this hormone are blocked, causing it to be secreted in excess. Use of corticosteroid medications. Prolonged use of oral or injectable corticosteroid drugs in high doses can lead to exogenous Cushing's syndrome. This is when high levels of cortisol in the blood are due to an external cause. These types of medications mimic the action of cortisol in the body and are often prescribed for the treatment of diseases such as cancer, asthma, joint pain, arthritis, or intestinal disease. Pituitary adenoma. This is a benign tumour in the pituitary gland that causes an overproduction of adrenocorticotropin, a hormone secreted from the pituitary gland in the brain which regulates the production of cortisol. At the same time, this causes a greater production of cortisol. This is the most common cause of endogenous Cushing's syndrome, meaning high levels of cortisol in the blood are a consequence of excessive production by the body itself. Adrenal gland problems. Some adrenal gland disorders such as adrenal adenoma or adrenocortical carcinomas can cause excess cortisol. Ectopic tumour. Although it is not very common, sometimes a tumour present in other parts of the body such as the pancreas, thyroid, lungs or thymus can cause adrenocorticotropin to be secreted in excess and consequently Cushing's syndrome occurs. Hereditary factors. It is possible that in some cases people inherit the tendency to develop a tumour in the endocrine glands which blood cortisol tends to raise. Discover more about another hormone in the body with the video we share above on prolactin. Symptoms of high cortisol. Depending on the level of excess cortisol in the blood, the patient will present varying symptoms. The physical symptoms are usually weight gain, appearance of purplish or reddish stretch marks, propensity for bruising, acne, wounds that heal slowly, hair overgrowth, irregular menstruation, constant fatigue, high blood pressure, muscle weakness, headaches, back pain, bone loss, growth problems, erectile dysfunction, decreased fertility, type 2 diabetes, and high cholesterol and triglyceride levels. Psychological symptoms include sensitivity, irritability, anxiety, mild depression, feelings of anger, and low libido. If this video is helping to answer your questions, consider providing a super thanks to help our channel grow. Treatment for high cortisol. The treatment for high cortisol will depend on the cause of the increase. It can be treated by corticosteroid reduction. The dose of the medication in question is reduced progressively over a period of time, and the patient is provided with appropriate treatment to control the symptoms of arthritis, asthma, or any other disease from which they may suffer. Surgery. The specialist may indicate surgery to remove the tumour that is causing high cortisol in the blood. After the operation, the patient will likely need to take medications that provide the body with the proper amount of cortisol. Radiotherapy. In some cases where it is not possible to remove the tumour completely, the patient will begin radiation therapy. It is also an option for those who cannot undergo surgery at all. Medicines. To control cortisol production, in some cases, the medical specialist may recommend taking medications before or after surgery. These medications include mitotane, metirapone, and ketoconazole. Natural treatment for high cortisol. In addition to the above, to lower high blood cortisol levels naturally and improve quality of life, it's important to carry out changes in lifestyle. Sleep 8 hours a day and enjoy a peaceful rest. To combat insomnia, before going to sleep, you can drink a relaxing tea such as lime blossom or valerian. Make sure your bedroom is a quiet space and its temperature is neither too cold nor too hot. Control the consumption of sweets. Any simple carbohydrates as well as processed foods increase blood sugar levels. Eat a diet rich in protein, complex carbohydrates, good fats, and lots of vegetables. Eliminate caffeine and alcohol. These drinks alter our nervous system, so excessive consumption increases cortisol levels. Stay well hydrated by drinking plenty of water throughout the day. Exercise will help you reduce stress, the main cause of high cortisol. It will allow you to feel better and also burn body fat. Include omega-3 in your diet. This nutrient has properties that help reduce high cortisol levels related to stress. Eat foods such as oily fish, egg yolk, vegetable oils, and seeds. Practice relaxation techniques such as meditation and yoga. If you want to exercise a little more, Pilates is a good option for healthy mind and body. And that's it for this On Salus Health video about high cortisol. If you want to continue learning about other common ailments, don't miss the playlist we share here. Like and subscribe for more videos to come, and we'll see you next time.